Are you aware that over 80 million people in the US have prediabetes without even realizing it? If left untreated, prediabetes can lead to type 2 diabetes, which increases the risk of heart attack, stroke, or cardiovascular disease. The good news is that prediabetes is fully reversible, but the first step is recognizing the symptoms. In this informative video, we discuss the top prediabetes symptoms you need to be aware of, including blurred vision, increased fatigue, unexplained mood swings, excessive thirst and urination, excessive hunger, achy joints, slow wound healing, and nerve tingling sensations. We also explain how elevated blood sugar levels can cause these symptoms and provide tips on preventing or mitigating prediabetes. Please note that we are not doctors, and this video is for informational purposes only. Be sure to watch until the end because some of these symptoms may surprise you. Don't let prediabetes go undiagnosed. Take action now to improve your health and prevent the onset of type 2 diabetes. What is prediabetes, and how is it diagnosed? Prediabetes is a condition that occurs when blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. It is a warning sign that someone may be at risk of developing type 2 diabetes. Prediabetes is diagnosed by a blood test that measures a person's fasting blood glucose sugar level. The test is called a fasting plasma glucose test, FPG, and is usually done in the morning before breakfast. A level between 100 and 125 mg per deciliter, milligram per deciliter, indicates prediabetes. Another test used to diagnose prediabetes is the oral glucose tolerance test, OGTT. This test involves drinking a sweetened liquid and then having blood drawn 2 hours later to measure blood sugar levels. A level between 140 and 199 mg per deciliter indicates prediabetes. Hemoglobin A1c, HbA1c test can also be used to diagnose prediabetes. This test measures a person's average blood sugar levels over the past 2 to 3 months. A level between 5.7% and 6.4% indicates prediabetes. It is important to get tested for prediabetes if you have any risk factors such as being overweight or having a family history of diabetes. If left untreated, prediabetes can lead to type 2 diabetes and other health complications. Fortunately, prediabetes can often be reversed through lifestyle changes such as weight loss, regular exercise, and a healthy diet. What are the early warning signs and symptoms of prediabetes? Prediabetes often has no signs or symptoms, which is why it's important to get tested if you have any risk factors. However, some people with prediabetes may experience the following early warning signs. 1. Increased thirst. When blood sugar levels are high, the kidneys try to remove the excess glucose by flushing it out through urine. This results in more frequent urination, leading to dehydration and increased thirst. The body tries to compensate for the fluid loss by signaling the brain to drink more water. 2. Frequent urination. As mentioned above, when blood sugar levels are high, the kidneys try to remove the excess glucose by flushing it out through urine. This results in more frequent trips to the bathroom. 3. Fatigue. When the body can't use glucose effectively for energy, it turns to fat and muscle tissue for energy instead. This can lead to feelings of fatigue and weakness, even after getting enough sleep. 4. Blurred vision. High blood sugar levels can cause changes in the lens of the eye, leading to blurred vision. This can be temporary and improve once blood sugar levels are under control. 5. Slow healing. Elevated blood sugar levels can damage blood vessels, impair circulation, and make it harder for the body to fight off infections. This can slow down the healing process for cuts and bruises. 6. Numbness or tingling. High blood sugar levels can damage nerves, leading to a pins and needles sensation in the hands or feet. This is known as diabetic neuropathy. 7. Increased hunger. When the body can't use glucose effectively for energy, it turns to fat and muscle tissue for energy instead. This can lead to feelings of hunger, even after eating. 8. Unexplained weight loss. In some cases, the body may break down muscle and fat tissue to use for energy when it can't use glucose effectively, resulting in unexplained weight loss. 9. Dry mouth. High blood sugar levels can cause dehydration and dry out the mouth, leading to a sticky or dry feeling. 10. Skin changes. Darker patches of skin, known as acanthosis nigricans, can develop on the neck, armpits, or groin area as a result of insulin resistance. This can be a sign of prediabetes or diabetes. 11. Irritability. High blood sugar levels can affect mood and lead to irritability or mood swings. This is due to changes in hormone levels and fluctuations in blood sugar levels. 12. Headaches. Elevated blood sugar levels can cause changes in blood vessels, leading to headaches, especially in the morning. 13. Infections. High blood sugar levels can impair the immune system and make it harder for the body to fight off infections, leading to more frequent infections such as yeast infections or urinary tract infections. 14. Poor concentration. High blood sugar levels can affect cognitive function, leading to difficulty focusing or concentrating, or experiencing memory problems. This is due to changes in blood flow to the brain and fluctuations in blood sugar levels. 15. Erectile dysfunction. High blood sugar levels can damage blood vessels and nerves in the penis, leading to difficulty getting or maintaining an erection in men. This is known as diabetic neuropathy. 16. Sleep disturbances. Elevated blood sugar levels can disrupt the sleep cycle, leading to trouble falling asleep, staying asleep, or experiencing restless sleep. This can be due to changes in hormone levels and fluctuations in blood sugar levels. It's important to note that these symptoms can also be caused by other health conditions, so it's best to get tested for prediabetes if you have any concerns or risk factors. Early detection and treatment can prevent or delay the onset of type 2 diabetes and other health complications. Prediabetes is a condition that occurs when blood sugar levels are higher than normal but not high enough to be diagnosed as diabetes. However, if left untreated, prediabetes can progress to type 2 diabetes, a chronic condition that affects how the body processes blood sugar. The link between prediabetes and diabetes is that prediabetes is a warning sign that someone may be at risk of developing type 2 diabetes. Studies have shown that people with prediabetes are at increased risk of developing type 2 diabetes within 10 years, as well as other health complications such as heart disease and stroke. The good news is that prediabetes can often be reversed through lifestyle changes such as weight loss, regular exercise, and a healthy diet. These changes can help to lower blood sugar levels and reduce the risk of developing type 2 diabetes. It's important to get tested for prediabetes if you have any risk factors or concerns. Early detection and treatment can prevent or delay the onset of type 2 diabetes and other health complications. There are several steps that people with prediabetes can take to prevent it from progressing to type 2 diabetes. Here are some key strategies. 1. Lifestyle changes. Changing your diet and exercise habits can help lower blood sugar levels and reduce the risk of developing type 2 diabetes. This includes eating a healthy diet rich in fruits, vegetables, whole grains, and lean protein, as well as regular physical activity. 2. Lose weight. If you are overweight or obese, losing weight can significantly reduce your risk of developing type 2 diabetes. Even a modest weight loss of 5 to 10% can make a big difference. 3. Quit smoking. Smoking is a risk factor for many health conditions, including type 2 diabetes. Quitting smoking can improve your overall health and reduce your risk of developing diabetes. 4. Get regular checkups. It's important to get regular checkups and blood sugar tests to monitor your condition and catch any potential problems early on. 5. Medication. In some cases, your doctor may recommend medication such as metformin to help lower blood sugar levels and reduce the risk of developing type 2 diabetes. 6. Manage stress. Stress can harm blood sugar levels and overall health. Finding ways to manage stress, such as through exercise or relaxation techniques, can help to reduce the risk of developing type 2 diabetes. By taking these steps, people with prediabetes can reduce their risk of developing type 2 diabetes and improve their overall health. Working closely with your healthcare provider to develop a personalized plan that is right for you as essential healthy lifestyle changes that can help prevent prediabetes are one of the most effective ways to prevent prediabetes. 1. Eating a healthy diet. A healthy diet is one of the most important steps in preventing prediabetes. Focus on eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed foods, sugary drinks, and foods high in saturated and trans fats. 2. Getting regular exercise. Physical activity can help to improve insulin sensitivity and lower blood sugar levels. Most days of the week, aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, cycling, or swimming. 3. Losing weight. Being overweight or obese is a significant risk factor for prediabetes. Losing weight through diet and exercise can help to reduce the risk of developing prediabetes. 4. Quitting smoking. Smoking is a risk factor for many health conditions, including prediabetes and diabetes. Quitting smoking can significantly reduce the risk of developing prediabetes. 5. Limiting alcohol consumption. Drinking alcohol can raise blood sugar levels and contribute to weight gain, increasing the risk of prediabetes. Limit alcohol consumption to no more than 1 drink per day for women and 2 drinks per day for men. 6. Managing stress. Chronic stress can raise blood sugar levels and increase the risk of developing prediabetes. Finding ways to manage stress, such as through exercise, meditation, or yoga, can help to reduce the risk. 7. Getting enough sleep. Lack of sleep or poor sleep quality can increase the risk of developing prediabetes. Aim for at least 7 to 8 hours of sleep per night and practice good sleep hygiene. By making these healthy lifestyle changes, people with prediabetes can significantly reduce their risk of developing type 2 diabetes and other health complications.